Okay, now I'm going to work the whole crest of the ilium, all through here. This is a really big part of the low back and back of the pelvis, obviously, the syndrome of pain. They can call it low back pain. It can be focused in here, but also for a lot of people, what they consider low back pain is coming off of this sacral area into the ilium. When these gluteals are highly contracted, that's what causes the pain, or is part of the pain syndrome. So I can feel this area with my fingers and palpate and get a sense of the tension levels, or if the tissue is fibrotic. Often the tissue will be fibrotic, meaning that there's scar tissue in there because of small micro tears that happen after a certain level of contraction. And then micro tears come into the fascia and it gets filled up with scar tissue, and it's called fibrotic tissue. And I can feel that on her. Most people have that somewhat in here. So with the back of my hand like this, placed with my thumb like this, very important, I bring my hand down in a broad stroke. The other hand can be here on the leg. You always touch with the other hand. And then I start to drop and ask her to breathe into her lower back, and I drop. Now this couldn't be the center of the pain syndrome that the person comes with. So if in that case, I'll stay a long period of time right on it, like 2 to 5 minutes, in a comfortable pain, moving slow, having her breathe. But in her case, I'm just going to show the stroke. Again, I'm moving slowly. I can also, if I tilt it a little forward, I start to work with these two knuckles, which makes it more specific, which is what I'm doing here now on Gopi, working those two knuckles and coming around. A little lower from the sacrum out and around on the gluteals. If I drop deep into here, a little lower like this, I start to work with the gluteus medius and the gluteus minimus. You know, I'm going to show with my elbow how to touch those two muscles. I'm with a broad forearm, elbow right on the crest of the ilium, and then slowly, is that okay? Yeah. She feels good in that pressure. Slowly I move over, pushing with my back leg, getting my power from here. You're not going to last long in this business unless you use your body right, because your shoulder and your arm will get too tight and you'll hurt yourself. So you want to push. I go like this from this angle. Another way of getting the same area, which I like, is to sit on the table. In this case, I'll use my right arm. And I just sit on the table and then fall into the stroke like this. Right down into her greater trochanter, all the way over here. And fall. I'm staying on the level of the gluteals here. I'm not working deeper. Okay. Now I'm going to show you a really nice stroke for the last stroke I'll do on the back of the pelvis, which is the piriformis muscle, one of the rotators. This is a nice way to approach it. So I'm going to work right where it attaches at the level of the sacroiliac, right where the sacroiliac joint is, and a little bit lateral to that. This is the best place to get it, to really make contact with that piriformis. If you go too much in the belly of the gluteals, you get it You touch it and start to release it, but indirectly. And at the same time, I'm stretching the foot down behind my back, rotating the hip internally, which stretches the piriformis. So as I work with my elbow, I'm stretching it with the downward pressure. This I find the best way to go into this muscle. When this muscle is tight, sometimes it compresses the sciatic or the ischial nerve because it goes right under it, and you get sciatic pain or ischial pain. So this is a good treatment often for sciatic or ischial pain, or numbness or weakness of the legs from the bad back syndrome, or the back of the pelvis when it's causing pain. And I work right down, especially at that area right where it attaches around the sacrum. I can work it. Ooh. Asking her to breathe into this stroke. Stretching it and then releasing the stretch, and stretch it and release it. So I go right down into the greater trochanter.